to me today. I want to use this as a first session format for those of you who are getting ready to start practicum or internship or in your practice. And I do think this is kind of a general good session format. Now, every client's different, every situation's different, but if you're feeling a little anxious, like what do I do? This may give you a few steps. We're going to use the acronym Dr. Help. Let's get right into it. We're going to discuss the issue. The clients come in, typically they've waited a while before they come in. It's usually not when something's going wrong in somebody's life. They're like, oh, I immediately have to go to counseling. They've typically talked with friends, family, tried different things. And so allowing time for folks to discuss their issue, how it's affecting their life. So that's the D. The next thing we want to do when the time's right with the right client is ask them to rate it. What we're hoping to do is help them balance the emotion side of their brain with the logical side. So we want them to be thinking, oh, wait a minute, on a scale of 1 to 10, where does this rate? For one, as the counselor, we can kind of measure progress with this type of scaling question. But a lot of this is about helping the client utilize more parts of their brain in order that we can bring everything we can into the healing process. Okay. The next part is helped. What helped them feel better in the past? Now, the purpose of this is to build collaboration. A lot of times you'll go to providers and they're automatically, well, have you tried this? Have you tried this? And we want to say, hey, wait a minute, you've probably tried some stuff, even if you're not aware of it. Let me hear it. I want to hear what you've done. It shows respect. It builds collaboration. Number 4, explore. Explore exceptions to the issue. When is this anxiety less for you during the day? When is the depression slightly less for you? When are you less angry, etc.? And then we want to explore what's going on at those particular times when what you're experiencing is not as severe. Number 5, life chapters. Help clients reframe this issue in their life. A cognitive strategy here of, oh, wait a minute, my life is chapters, and maybe this chapter that I'm in right now is not very good, but that does not mean that the next chapter is going to be the same. And so help them start to reframe life as life chapters, and that they can begin creating chapter 2 or the next chapter in your office with you. You're going to collaborate to do that. Okay. Lastly, past successes with similar problems. It's kind of similar to 3, but with number 4, where we're exploring exceptions. However, with that one, we're looking at, hey, just during the day, when do you feel better? With number 6, we're wanting to say, hey, you've probably had situations that may not have been exact that were similar. What did you do that helped, even just a little bit, even if just 10%? What helped you? Okay, so as a general strategy, Dr. Help just keeps you in this format of cognitive restructuring, of collaborating, of allowing the client space to discuss their issues, and also view things from a different perspective. So we're a little bit, there's a lot of solution-focused techniques here. We want people to start to recognize how they can re-narrate their story. All right, good people, let me know what you think about this. Good luck with your sessions, and we'll talk to you on the next video. Take good care.